right. Hi there. Hi, everyone. I'm Rendy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department. Today is Monday, September 13th. It is my nephew's birthday, so happy 10th birthday, Grady. I'm here to give you the COVID-19 update of the impact of the pandemic on Mobile County, our residents, our workers. So the cumulative number of COVID-19 cases is just over 69,000, 69,198. 130 cases were added yesterday. You know, we usually see a low number of cases reported over the weekend, but that's a really low number. And we're happy about that. So we will hopefully continue to see a reduction in the number of cases reported to us. Yesterday, 2 deaths were reported to us. That brings the total number that have died to 1,129. An additional 14 people were hospitalized yesterday with COVID-19 or in the hospital diagnosed with COVID-19. That brought the cumulative number of hospitalized with COVID to 8,391. Yesterday, there were 237 people in the hospital with a COVID-19 diagnosis. And again, we've been in the 200s now for 5 days in a row. So we're really happy about that. The numbers of cases and hospitalizations that we are seeing now are similar to what they were in about the middle of July, just to give you some perspective about how we're coming down the better side of this very historic outbreak of COVID-19 in Mobile County. Again, most of the cases reported to us are in very young populations. 90% or more are in unvaccinated people. 85% of the people in the hospital are unvaccinated. So again, just continuing to see transmission being driven in folks that do not have vaccine coverage. Remember, to slow the pandemic, we really have to take a layered approach. Primary prevention or getting the vaccine is the best way to slow the outbreak and protect yourself from hospitalizations and deaths. And then adding on wearing a mask, staying 6 feet away from people, or distancing yourself from people that you don't know, staying at home if you're sick or if you've been exposed, increasing ventilation, all of the monitoring your symptoms, getting tested frequently if you aren't doing those things, just to make sure that if you have COVID and don't know it, you can get a test and know that you're potentially spreading it and can stay home. So we also published our weekly expanded report this week. So take a look at that. When we look at last week, it went up slightly from the week before, but remember we had that big spike, that artificial spike last week due to a backlog of laboratory results. So I'm not going to get too worried about that because we do have an explanation behind that. So hopefully next week we'll get back to normal and can see the sort of steady decline week after week that we would like to see. Hopefully see the slowing down. People are starting to ask me, have we seen the Labor Day spike yet? We're still, we're 1 week past Labor Day. So remember, the incubation period is 2 to 14 days. So we have still about another week after Labor Day to hit that 14-day post-Labor Day mark to know whether we're going to see a spike due to Labor Day. Let's see, the percent of ED visits that are attributed to COVID-like illness is down to around 6%, 5.5% or 6%. That is much lower than it has been in the past month. So that is really good news. Last week, we recorded 29 COVID deaths. That is a reduction from the week before, so that is good news. And then the percent positive, so of all tests, all COVID tests, what percentage of them are positive, and that's down to around 15%. So that is still alarmingly high, but down from the high of 31% in late July and early August. We are seeing outbreaks still all over town, lots of cases in schools. The number of cases in schools is still high and increasing. So we are still keeping a close eye and worried about schools as they deal with transmission in a population that are either ineligible for vaccine or have low vaccination coverage. But a couple more things I just wanted to announce, or talk about rather. This week, remember, we're going to go back to having COVID Facebook Live updates just 2 days a week, so Monday and Thursday. So today, Monday, after the weekend is usually a little bit longer than most, but let me just mention a couple of things. I wanted to sort of share. People have asked me about the Mu variant that was first isolated and identified in Colombia. That variant has been found in almost every United States, though it is a very low proportion of the of the COVID variants that we see. So less than 0.1%. In Alabama, Mu has been detected in 5 individuals. One of those was in a Mobile County resident. All right, last week, because of the Labor Day, Mobile County Health Department had a shortened week of vaccine and testing, but just wanted to report to you that last week we ran 1,618 tests, and about 13% of those were positive, and we gave 797 vaccines. About 40% of those, or around 315, were third doses. We have seen a really stark reduction in people seeking testing and vaccine at our health department locations. And in fact, the volume of testing is down across the county. The volume of vaccines being administered on any given day or week is down around the county. So not sure what's going on there. It could be back to school, back to Saturday and Sunday football schedules. Maybe that is causing people, to no longer seek vaccine and testing. But we just want to remind everyone that it's still really important to get vaccinated. It's super important to get tested. If you think you've been exposed to COVID, if you just want to double check, we're here to provide walk-in testing at our 2 locations. At 251 North Bayou, we still are running Monday through Friday, 9 to 3:30. At our 248 Cox Street location, we're going to be amending the hours this week. We still will be going 9 to 7 on Monday through Friday, but we're going to 10 to 2 on Saturday, and we will be closed on Sunday. So go to mchdcares.com for those updates to make sure you get the hours and the locations correct. All right, there were several publications that came out last week from CDC giving information on vaccine effectiveness, looking at several different studies, several different populations, and I just want to give you sort of the high points of these 3 MMWR reports. One talks about estimates of vaccine effectiveness against COVID-associated emergency department or urgent care clinic encounters and hospitalizations. So how well does the vaccine prevent hospitalizations or prevent urgent care or emergency department visits in the age of COVID? So this was looking June through August. How well did the vaccine work? And even during Delta, vaccine effectiveness of all 3 COVID vaccines remained high against hospitalizations, 86%. So it prevented hospitalization 86% of the time overall, and prevented emergency department or urgent care encounters 82% when you look at just all 3 of them combined. There are differences when you look at the product. So vaccine effectiveness was slightly higher for Moderna than Pfizer or J&J. And this is a sort of a growing body of evidence, but it needs to be further studied. But it suggests that Moderna vaccine recipients are slightly more protected against hospitalizations and ED visits in urgent care than Pfizer or Janssen. I just want to comment on that in case you were trying to decide what vaccine product to take. So all of them are really good. It's just that when you look at each of them individually, Moderna is slightly better than Pfizer, and they are both slightly better than Johnson & Johnson. Another study about, again, looking at hospitalizations and deaths, vaccine effectiveness against hospitalizations and death, and this really was sort of focusing on, is the Delta variant more severe than the Alpha variant or parent COVID? And what that study found is that Delta is more infectious, but not necessarily more severe, and that the current vaccines are working to prevent hospitalizations, but its ability to prevent infection may be going down or waning slightly. So again, the Delta variant is not causing more severe disease or hospitalizations. It's just that the volume of those is much higher because it's so infectious, right? And the vaccines are still working against the Delta variant as far as hospitalizations and deaths go. It's just that it may be less effective about preventing infection. And then the last one, it was similar information, but was just done in a different population. So again, just more information saying that the COVID vaccine is effective. This was 5 Veterans Affairs Medical Center. So looking at sort of effectiveness by age group. So not by vaccine product, by looking at it by age group. And still overall, even though it's Delta, there was a high coverage, right? High vaccine effectiveness, but it was higher in younger persons, right? So in people who were vaccinated and were older, if you're 65 or older, the full vaccination was about 80% at protecting you from hospitalizations. For younger adults, 18 to 64, it's about 95% effective at preventing hospitalizations and deaths. So just a couple of good studies just to talk about how well the vaccine is doing against Delta. All right, another question I get from time to time, and I think this was asked earlier in the week, I didn't exactly know the answer, I just had to refresh my memory, is about what's called post-COVID conditions or long COVID. In the media, some people are calling it the COVID long haul. And there are really sort of three different sort of types of post-COVID conditions. So one is where you'll have new or ongoing symptoms long after your sort of 10 days of infectiousness, right? So you might have a range of new or ongoing symptoms lasting weeks or months after first being infected. So these could be things like shortness of breath, fatigue, symptoms that get worse after physical activity, brain fog, cough, stomach ache, headache, heart palpitations. It's a whole lot. Sleep problems, diarrhea, rash. I've heard a lot about rash. Mood changes in smell or taste. So a lot of things have been reported weeks or months beyond your initial COVID diagnosis that are considered a post-COVID condition. Another type of post-COVID condition is our multi-organ effects of having the infection. So some people may experience multi-organ effects or autoimmune conditions over a longer time with symptoms lasting weeks or months. So it could affect most or maybe all of your organ systems, including heart, lung, kidney, skin, brain, that sort of thing. So there's also another post-COVID condition that affects your immune system. It causes multi-system inflammatory syndrome, and this can happen in children or adults. It's been we know the most about it in children, but this is again sort of a multi-organ effect of having a COVID diagnosis or having a COVID infection. And then the last category is really sort of the lasting effects of being hospitalized, right? So if you are in the hospital for a really long time, maybe you had to be intubated, maybe you had ECMO. So the effect of hospitalization is also considered sort of a post-COVID sequelae that can affect some people that, after they're hospitalized and they try to recover, they may continue to have negative health effects due to that hospitalization. All right, questions. All right, someone's saying that they originally got the J&J vaccine but have had several underlying health conditions. Can they get an additional dose of Pfizer or Moderna? So I get this question a lot about starting a new series for people that receive Johnson & Johnson. And right now, there are no recommendations for starting another series or getting additional doses of J&J. So we'll just have to wait on the FDA to tell us when or if they may consider that. Will the COVID third shots of Moderna and Pfizer be any different than the original vaccine? So this was sent to us by TJ. Thank you, TJ. So no, the third shot in the primary series and a booster dose when or if it is recommended, those are all exactly the same product. Someone asking if flu is going around right now. Yes, we are seeing a slight uptick in influenza-like illness in emergency departments. It's not above threshold yet, but we are seeing it slightly increase. Someone's asking me to comment if we're getting it under control or not. I think it's controlling us. We are not controlling it. We could have controlled it by having a large proportion of our population vaccinated, and we didn't get there. And so now, we are under the control of the pandemic. You can have some personal control and some personal responsibility by getting vaccinated and wearing your mask and distancing, staying at home if you're sick. If you do those things, you're doing everything you can to control the outbreak. But getting it under control takes a whole community working together to implement those layered effects, including vaccination. So it is getting better, and people, out there, please continue doing the right thing. And but right now, for the past July and August, for the past 2 months, COVID-19 controlled us. We did not control it. All right. Any other questions, Mark?
Just similar. Said one dealt with severe hair loss from COVID.
Oh.
And another one memory loss and a lasting cough.
Okay. So some Facebook viewers commenting that some of their lasting symptoms have been hair loss, cough, and memory loss. Yep, that's it. All right. So we will be back here on Thursday at 2:30. And until then, be safe. Get vaccinated. The lines are short. Wear your mask. Stay at home if you're sick. Don't be around people that you don't know. And stay safe out there, everyone. We'll talk again on Thursday.